Hello, I'm Teresa.
I'm Molly.
And I'm Olivia.
And we are AIC DPT second year students. And today we're going to show you how to perform a stand pivot transfer. Initial things to think about: environment, patient, you. First, you want to make sure the environment is already set up before you get this patient up. Make sure the floor is dry and clear of any objects. The wheelchair or transfer chair should be angled facing inwards towards the transferring surface to facilitate the transfer. If possible, raise the bed to be higher than the transfer destination to allow gravity to help you. It's easier to perform a transfer from a higher to a lower surface. Wheelchair brakes must be locked, armrests and footplates removed. Make sure the patient is wearing a gait belt and proper footwear. If using an assisted device for the transfer, make sure it is within reach. First, check the patient's cognitive status, alert and oriented ×3.
Hi, Olivia. What is your name?
Olivia.
Do you know what day it is?
It's Thursday.
Okay. Do you know where you are?
I'm at AIC.
If the patient's not cognitively aware, safety can be of concern due to their inability to follow commands. Assess vitals if they have any history of cardiac insufficiency. Assess bed mobility to assess their ability to transfer. This will be crucial for choosing the type of stand pivot transfer. Weight-bearing status as ordered by the MD.
Okay. Do you know your weight-bearing status, Olivia?
I think I can't put any weight on this left side.
All right. Awesome.
Take into consideration the patient's prior level of functioning, home environment, and personal functional goals when choosing the transfer direction. We want to encourage independence and decrease dependence. Now for the stand pivot transfer. Explain the transfer to the patient and demonstrate the technique you will be using. And have the patient repeat back your instructions so that you can make sure they understand. Verify with the patient their weight-bearing status and ask them to repeat back to you what this means. Emphasize to the patient the importance of not grabbing onto the therapist, their neck, or shoulders during the transfer. Now, deciding which direction to pivot. The patient can pivot towards the affected or unaffected side. In the beginning learning stages, it may be easier for the patient to transfer towards their unaffected side. This allows them to put the majority of the weight through the stronger side. It may also assist with weight-bearing precautions. Having the patient transfer towards the affected side encourages patient use of the weaker leg and reinforces functional use of to facilitate recovery. In certain situations, the bed chair surface setup only allows for positioning to transfer in one direction. It is important to practice transferring to both sides so that they won't be limited in mobility, either in hospital, clinic, or home setting. Now, to block or not to block. The therapist can choose to perform a leg block to provide additional support during the transfer. You first must decide if the patient needs additional support and will benefit from a leg block. If you decide to block, you can block the involved or the uninvolved side. Reasons for blocking the involved side include providing extra support and stability during the transfer, providing support for the therapist in the event the patient goes down, and giving the patient a little extra sense of security. Reasons to block the uninvolved side include providing stability to the leg which will bear most or all of the weight during the transfer. Whether you choose to transfer to the strong or weak side, or to block or not block the leg, is not necessarily wrong. However, you need to justify your decision. Patient position. Have the patient scoot forward to the edge of the bed or chair. Feet should be flat on the floor with their hands on the edge of the bed or chair to assist with push-off. Feet should be staggered so the foot you are transferring towards will be in front. The other leg should not be behind the knee so that the knee is at a greater than 90-degree of flexion. For this demonstration, let's pretend that Olivia is weight-bearing on both legs. So the leg that she is transferring towards will be in front, and the other leg should be at no more than 90 degrees staggered behind. Therapist position. The therapist needs to position themselves to work smarter, not harder. A proper stance will be to ensure safety not only for the patient, but also for the therapist. Therapist will have a wide base of support with a staggered stance. The leg which is closest to the transfer destination should be the posterior leg in the tandem stance, while the leg distal to the transfer location will be more anterior. Great job, Molly. Perfect therapist position. The therapist needs to bend their knees to be able to use lower extremity strength and to avoid muscling the transfer with their back and upper body. The therapist will use a supinated grip on the lateral sides of the patient's torso around the gait belt. The therapist will angle their head towards the transfer destination and instruct the patient to direct their head over the therapist's opposite shoulder. Now for the transfer. Instruct the patient to perform as much of the work as possible to facilitate the transfer. Remind them that the therapist is there for safety and not to move the patient from one spot to another. Show the patient how to direct their head to the therapist's opposite shoulder and remind them not to grab onto the therapist. The arm position can be adjusted based on the patient's needs. The patient may have a crutch that they will be holding. The therapist could also choose to have the patient cross their arms over their chest during the transfer if they are more of a min or a mod assist. Instruct the patient to reach for the chair during the controlled descent. Make sure the patient feels the chair on the back of their legs before slowly sitting. Before initiating the transfer, do a quick screen of the setup to make sure the patient hasn't moved or changed positions. Patient will flex forward at the hips so that their nose goes towards their toes at about 45 degrees of flexion. Have the patient rock forward 3 times, counting out loud.
1, 2, 3.
The transfer will be initiated on the 3rd rock. Patient will rise their bottom from the transfer surface, coming to a standing position, and pivot towards the transfer destination.
Alright, Olivia, so you're gonna stand pivot transfer to this wheelchair right here.
Okay.
Alright, did you understand all the instructions?
I think so. And I want to make sure that I have my legs on the chair before I sit down.
Yep, you want to feel that wheelchair right on the back of your legs before you start. You want to make sure you're grabbing for those, reaching for those handbars, and then slowly lowering yourself down, okay? And what are you going to remember about this leg?
I can't put weight on it.
Exactly. Alright, so on the count of 3, we're going to do this. Ready?
Okay.
Nose over toes. 1, 2, 3. Up. Good. Feel that chair. And slowly lower down. Good.
All right. Now for this demonstration, Olivia is weak on both sides and has no weight-bearing restrictions. We are choosing to pivot to the right side, and Molly will initiate a leg block.
Alright, Olivia. So we are going to stand pivot transfer to this chair right here. We're going to go to your right side because that's where your chair is, at the side of your bed. And so since we're going to your right side, I'm going to be blocking this leg. Since we're transferring to that side, we're going to count to 3. You can rock back and forth. And then I want nose over toes. You're going to stand all the way up. You're going to pivot on the balls of your feet. And then I want you to take a couple steps back until you feel the wheelchair right behind your legs. As soon as you do, I want you to reach back for the handrails and slowly lower yourself down. Now when we're doing this transfer, I just want you to keep your hands crossed in front of your chest until you start to reach back for that the handrails of the wheelchair, okay?
Okay.
All right, do you understand? Awesome.
Yes.
All right. And count to 3. Yep, good job. 1, 2, and 3. Yep, good. So that chair, reach back and slowly lower down. That's good. 1, 2, 3. Up. And reach back. And slowly lower down.
In this setup, we will be pivoting to the right side, Olivia's affected and weaker side. Molly is choosing to do a leg block on the weaker side.
All right, Olivia, count of 3. Nose over toes. 1, 2, and 3. Up. Put it on the balls of your feet. Reach back and slowly lower down.
All right, and in this setup, we are pivoting Olivia to her left side, the stronger, uninvolved side. Reason being here is that Molly wants her to be able to use most of her lower extremity strength on that left side. Molly is also choosing to do a leg block on the stronger side to ensure that the patient does not go down.
All right, Olivia, on the count of 3. 1, 2, and 3. Good. And reach back.